Good day and welcome back. I'm Dr. Scott, your online headache doc. Welcome to Relief at Last, what your doctor won't tell you about your migraines, your headaches, and your pain. Today's episode is near and dear to my heart, and we're going to discuss kids with migraines and headaches. At the time of this recording, the youngest patient that we see in our day-to-day practice is 8 years old, and I cannot tell you how proud of his parents I am for finally taking action to pinpoint the cause of his migraines and actually address that cause once and for all. As you may know, I'm the only doctor of any kind certified by the American and International Boards of Commonsensical Medicine. And sometimes it just takes a healthy dose of common sense to get parents to take action and finally understand why their child is having migraines or why their child continues to report ongoing headaches. In our healthcare system, or as we know, our symptom treatment system, when children complain of headaches and migraines, sometimes we brush it off as either a phase. Yeah, well, you know, kids go through phases, right? Maybe they'll outgrow it. And when the headaches or the migraines continue, we take them sometimes to the pediatrician. And the pediatrician will say, you know, that just happens to some children. So we'll just have to find the next best way to either manage these symptoms or treat the migraine and headache symptoms as they arise, which they inevitably continue to do. Or we're told, you know, kids are very resilient. They'll outgrow it. It's either a phase, they're resilient, absolutely, positively not. We established with our 3 essential foundational principles weeks ago that, according to principle number 1, headaches of any kind are absolutely never normal, but they always happen for a reason, even if your doctor has not been able to pinpoint that reason or that cause thus far. And we also established with our foundational principle number 2, if you don't know what the real cause of your child's migraine and headache symptoms is, the chances of them finding some kind of significant long-lasting relief will remain slim. And sadly, the longer you continue to ignore your child's headaches or migraines, the more often they will likely happen, the more severe they will likely become, and the greater the chance that those headache symptoms will develop into other, possibly more severe, longer lasting, and permanent healthcare issues. Now, as a father of 6 now adult children and 2 grandchildren at this point in time, I understand. We want nothing but the absolute best for our children or our grandchildren. But as parents, you have to rely on your doctor's advice. We put our trust and confidence in our doctor's recommendations. And as you also know, the purpose of this podcast each week is to make you the expert on your condition and to make you the expert on your child's headache or migraine condition. Because, as we've already established as well, the vast majority of the time, our doctors either are not able to find or pinpoint the real true cause of our child's migraines and headaches, or they simply don't know what to do to treat or manage them other than drugs and drugs. And if that doesn't work, let's try some more drugs. I also established last week that taking drugs day in and day out to attempt to temporarily treat or manage your child's migraine or headache symptoms doesn't make them healthier, and it doesn't address the cause of their migraines or headaches. It just makes them drug dependent. Let's not raise drug dependent children. Let's not raise drug dependent grandchildren. Let's use a little bit of commonsensical medicine. Let's make you the expert, and let's focus, number one, first and foremost, there isn't a close second, on pinpointing the real true cause. Decades upon decades of medical research is crystal clear. It's out there. And you can't count on any doctor of any type, of any specialty, to know, understand, or certainly communicate that research to you. This is your job as a parent to know, understand, and apply the decades upon decades of proven published medical research, which will help guide you in the direction toward identifying why. Why is your child having headache or migraine symptoms? And then that will then lead you into a long-term solution, not to treat or manage the symptoms temporarily, or at least attempt to do so, but address the true cause once and for all. Is that possible? I'm living proof. It absolutely is possible if you consult a specialist who focuses first and foremost on the cause and not treating the symptoms. By the way, a commonsensical note. The cause of your child's migraines or headaches is not a shortage of chemical drugs in their body. So again, we rely, sometimes too much, solely on our doctor's advice and recommendations without knowing the real true cause and without knowing what the proven published research has said for decades upon decades upon decades. So today, what do you do? What action can you take if your child is reporting symptoms of headaches? Maybe your doctor or pediatrician has even given them even though it's a false diagnosis, but given them a diagnosis of migraines of some type. And as we know from previous episodes, the types of headaches and migraines are countless, and they simply just describe how the symptoms manifest themselves in your body or in your child's body. Let's not focus on naming your child's headache. Let's focus on pinpointing the cause. So, number one, has your child received a true diagnosis? And by the way, if you've been told your child has migraines or your child has headaches of any type, that is not a true diagnosis. That is what we call a false or a medical diagnosis. Puking your symptoms right back at you and calling it a diagnosis. I know that I've got headaches. I know that I've got migraines. That's why I came to see you, doctor. What I want to know is, what is going on inside of my child's body? I'm concerned. What's going on inside of my child's body that's resulting in them having headaches? What's causing their migraine symptoms? That is a true diagnosis, and that is not optional. You've got to have a true diagnosis. You've got to know what the cause of the migraine and headache symptoms is before you can put into place an effective treatment plan that's going to address the cause once and for all. And let me tell you this, I've lived this myself. You may be able to relate to this. If your child is missing school, unable to attend classes, and by the way, This is the time of the year heading into August and into the school year where the incidences of migraines and headaches in school-age children skyrockets. Skyrockets. At the time of this recording, we have children in our day-to-day practice as young as 8 years old. And let me tell you this, I cannot tell you how proud I am of his parents for taking action and for questioning their doctor's advice and recommendations of drugging their child with potent chemical medication, somehow hoping that's going to either reduce or eliminate the migraines. Stop guessing. Stop hoping. Stop trying things out on your child, hoping that they're going to get the relief that they need and that they deserve. Our children count on us as parents to give them the best advice, not only with their health, but obviously in life, and to take care of them. And when they're not feeling well, they count on us as parents to give them not only effective advice, but advice that they have trust and confidence in as well. Now, let me define this. In my day-to-day practice, when we say kids with headaches or children with headaches, that could mean children as young as elementary school, children in middle school, certainly children of high school age and college age. So, children of all ages, so to speak, can be afflicted with migraine and headache symptoms, not migraine and headache disorders. This is not a neurological disorder we're talking about in most cases. These are neurological type symptoms that are resulting from another underlying issue, and according to decades upon decades of research, more than likely, and more specifically, in excess of 70% of the cases of headaches of all types is an upper spinal disorder, a disorder near the base of your skull where the brain and the spinal cord meet. Our doctors don't know this as a whole. Yet hundreds upon hundreds of times this has been published in medical research and clinical data, over and over and over and over again. So you, as a parent, now know more than the vast majority of doctors, including headache and migraine specialists, about the most common cause of your child's migraine and headache symptoms, and that is a specific upper spine disorder that may compress the spinal canal, resulting in migraine and headache symptoms. Your doctor more than likely is not trained to even recognize this disorder. So you as a parent must be persistent with your doctor. You must question your doctor, as we discussed last week. You as a parent must become an equal opportunity skeptic. If your doctor cannot look you in the eye and say with certainty, this is what's going on inside of your child's body resulting in their migraine and headache symptoms, then they are not the expert. You can't fix the problem if you don't know what the cause of the problem is. And secondly, as we mentioned last week, even if you're one of the lucky ones, if you are able to find a specialist that can pinpoint with certainty and show you what's going on inside of your body or your child's body that's resulting in the migraine and headache symptoms, your child's chances of finding significant relief and certainly long-lasting relief will continue to remain slim. Missed school attendance, not able to participate in activities, whether that's extracurricular, sports activities, drama. You can't participate if you just don't feel and you just don't function like a normal child and you don't feel like yourself. absolutely positively, here is the message that we as parents must get from this podcast today. Don't you dare ever ignore your child's complaints of headaches. Absolutely never. They are happening for a reason. And you absolutely must focus on pinpointing that reason, on finding the real true cause of your child's headache and migraine symptoms, and then find a multi-specialty migraine and headache specialist that will personalize and customize a plan that will address the cause of your child's migraine and headache symptoms once and for all. I've lived this, and I've been lucky to have found an amazing migraine and headache specialist who was able to 100% completely eliminate my migraines. I have now been migraine-free for well over 3 decades without any need for ongoing treatment of any kind whatsoever. It's absolutely possible if you're able to pinpoint the true cause and put a plan into place to address that cause for good. Then absolutely relief for your child is possible. However, if you are stuck on the medical merry-go-round of trying this and trying that and trying this and trying that, you're never going to get off. Your child will continue to pay the consequences. Your child will continue to suffer. And as parents, that's not what we want for our children. I mentioned last week that in the next week or two, I have a huge announcement upcoming. And part of this announcement is going to include resources that will be available for you to help guide you in the right direction. Step by step, simple guidebook that's going to help you decipher what do you do next? Where do you go? Who do you see? Who do you believe? Who do you not believe? Should you be skeptical of? Should you not be? There's too much confusion in the healthcare industry as a whole, too many conflicting opinions, and that puts you and I as parents or grandparents in a terrible position. It puts us in the position of having to guess with our child's health, which is not what any of us want to do. So please, in the coming week or two, you absolutely positively must follow this podcast, like this podcast, please, and as I've said time and time again, and most importantly, please share this podcast with someone you know, with someone you care about, who continues to battle ongoing migraines and headaches, or has a child that continues to be affected with ongoing migraines and headaches. This is my purpose in doing the podcast. Help make you the expert so you're able to guide your child in the right direction, make the recommendations that are best for them, and that you're confident in, and that most importantly will provide your child significant, long-lasting relief from their migraine and headache symptoms. If you continue to try the same treatment over and over and over, you're going to continue to get the same result. And that is either absolutely no relief, or, if you're lucky, maybe a little bit of temporary short-term relief at best. But you can't continue to ignore the cause. And if you continue to look for the cause of your child's migraines and headaches in the wrong place, you're never going to find it. You have to look in the right place to find what you're looking for, and that is the real, true, proven, documented cause of migraine and headache symptoms, both in children and in adults. thank you kindly for joining me once again. Again, please share this with someone you know or care about. I'm Dr. Scott, your online headache doc. Those are the facts. Everything else, well, that's just another opinion. The information contained in this podcast is not meant to substitute for your doctor or healthcare provider's advice or recommendations. It is based on Dr. Scott's more than 31 years of private practice experience so far, specializing exclusively in migraine, headache, and chronic pain disorders, as well as decades upon decades of proven, published medical research. Thank you for listening. Copyright 2024, Milagros Media.